Good morning and welcome to the show. It's Monday morning, so you know what that means. I have Dr. Roman Nation here in the studio to give us some medical news. What's the big news this week, Doc?
Well, we were talking just before the break. The DEA announced, or not DEA, the FDA announced last week that hydrocodone, which is a really, really common pain medicine drug that a lot of folks use, is changing schedules. So it's a lot more controlled now than it used to be.
What does that mean, changing schedules? Because we hear these terms Schedule 1, Schedule 2 drugs.
Yeah, so the FDA has different schedules 1 through 5 of drugs. So things like Lyrica and Ambien, Xanax, Valium, those kinds of things, those are all Schedule 4 and 5 drugs, which means that you can usually fill between 30 and 90 days at a time, and you can put refills on it for up to 6 months. But if your prescription is dated like today, and you try to get the refill done in 6 months in 1 day, it's no longer valid. So you have to go back to your doctor to get a new prescription. The other thing that the lower schedule ones, like Schedule 3 and 4, is you could call medicines in like that. And so meaning that the doctor could pick up the phone.
But now that hydrocodone is what, Schedule 2?
It's moving to Schedule 2 in about a month.
Okay.
And tramadol is another one that we commonly use. It was not controlled up until about 2-3 weeks ago now. Where you could write it on, you could write out a script, you could call it in, you could put refills on it, and it wasn't tracked.
I don't know what tramadol is. What is that?
It has some opiate type effects, but it's not an actual opiate like morphine and hydrocodone and oxycodone and a lot of the other addictive substances that we see, people having overdoses from.
So what are the ramifications for hydrocodone becoming a Schedule 2 drug?
Yeah, so what it means is that you have to have a written prescription now, meaning that the doctor's offices can't call them in at all. And it's in the same class as oxycodone and Opana and morphine. There's an extended release version of morphine.
And I don't know what half those things are, but they all sound highly addictive.
Well, those are all the pain medicines that you hear about in the news a lot from people doing overdoses and stuff. And so you have to have some of the other ones that are in the Class 2 schedules, like Ritalin and Adderall.
Oh my.
So those are all also considered Class 2 medications. So to me, on a personal level, there's a lot more danger in the opiate class of stuff because those are easier to cause problems with. But at the same time, the ADHD medicines are also decently addictive, and that's why, because they're amphetamines. So that's why they got put in that classification. But depending on the insurance plan that you're dealing with, some of them will only fill 30 days at a time, and others will fill up to 90 days. So like there's a few pharmacies around town where you can get them to fill a 90-day supply of things like Adderall or Ritalin or Concerta if the patient's been stable and they just take it every day.
It's interesting that you say there's some pharmacies that you can get them to. I mean, once you write a script, don't they have to fill it?
Yeah, actually, you would think that. But the seminar that I went to earlier this year, the FDA makes rules on these classes of medications that, so Class 2 stuff, you can't put any refills on the prescription, and it has to be a paper prescription. Okay, can't call them in. All the other ones you can call them in, or you can put refills up to 6 months.
So basically, the patient has to show up with the script in hand.
Yes.
To the pharmacist.
Right.
And they can only fill it for 30 days if it's a Schedule 2.
It depends on the pharmacy. So, like I said, the FDA allows them to fill up to 90 days. So like I could write a script for up to 90 days, but the pharmacy is under no obligation whatsoever to fill it for 90 days.
So the pharmacy can say, I don't want to expose myself to the liability of an over prescribing something to someone.
Yeah, or from a company perspective, like Walgreens and CVS, they'll only fill 30 days at a time for these Class 2.
And that's just their flat out policy.
That's how they treat all Class 2s. So. But yeah, the pharmacist is under no obligation to actually honor the doctor's request, which is really interesting. When you talk about, you'd think that, hey, the doctor wrote it, so the pharmacy can just go ahead and go along with it, but they don't have to. And they can set their own policy on how much they want to fill or not fill. Like they can even put caps on the amount that they'll dispense.
That's amazing stuff. We got to run off to the local weather and a break and all that, but on the other side of that, I want to talk about the ramifications that has for docs, for your practice, and for patients, too, who may legitimately need it.
Yeah.
And we'll be right back after your local weather, brought to you by the West Pittman Law Firm. WestPittmanLawFirm.com. Welcome back to the show. I'm here with Dr. Roman Nation, and we're talking about a change in schedules for drugs.
Yes, sir.
And some very popular drugs, too, that are now becoming
Common. Yeah.
Common, rather,
Yeah.
or maybe popular.
Yeah.
Maybe popular with some people, but
That is true.
commonly prescribed meds that
Yes, sir.
are become Schedule 2
Yeah.
because of their addictive quality.
So what it means for the average person who is using hydrocodone for chronic pain, and we have a lot of older patients with like osteoarthritis, and they're not surgical candidates, and they failed physical therapy, and we've tried all these other interventions that we can do that don't require opiates, and that's the only thing that really benefits them or has provided some relief for them. They have to get seen every 30 days for refills now, just like if they were on Percocet or MS Contin or lots of other medicines like that.
So hydrocodone, which is
It was
commonly
a Schedule 3, now it's
was
Schedule
Schedule
2.
3 is now Schedule 2.
Yep.
And so now you can only prescribe for 90 days,
Usually 30.
usually 30, but the pharmacist is not under any obligation
Right.
to honor that 90-day script, and they say, nope, I'm only going to give you 30.
Right. And most of
because
them do.
that. So now for a patient, that means they got to come back and see you every 30 days
Correct.
to get a new script.
Yep.
And maybe they got a $40 copay. So
Or
they got
whatever
to
their
keep
right.
coming back to you just for basically administrative purposes.
To a certain extent,
Yeah.
yeah. The idea behind it really is that because of all the drug overdose deaths that they have, there's over 20,000 deaths a year from drug overdose that are technically preventable.
Wow.
Just in the U.S. We're not talking about worldwide. But just in the U.S., there's more than 20,000 deaths. And hydrocodone, I think, was number 2 on the list.
Is hydrocodone, and maybe I lead a sheltered life, but is hydrocodone a very abused drug, and is this why they're doing that?
Yeah, it's the most commonly abused prescription medication.
Well, then you can see why the
Well,
feds
they're
are
trying to
doing
ratchet
this.
it down. Yeah,
well, we're trying to ratchet that
They're
back.
trying to get more eyes on the situation for people that every time they sign their signature is like, well, maybe I'm doing a little bit too much here. Maybe I need to crank it back. Things like that.
Or maybe this guy isn't in all that much pain. Now, you talked about a theoretical patient who's elderly, perhaps, and needs it, but maybe you got some young guy who's like, yeah, my back hurts,
Right. Actually, it's you bring up a really good point there, because finances play a pretty good sized role in how often patients want to go to their doctor's office. We have folks that won't go to physical therapy because it'll cost them $20 to see their primary doc, but it'll cost them $40 to see a physical therapist. Well, a physical therapy regimen is usually 12 visits in a month, so 3 times a week for a month. So, I mean, that's more than a car payment worth, so they won't go, and then they come back saying, well, I couldn't afford this, but, this seems to work, so can we just keep doing that? Well, adding that extra copay on top of that now, it's going to change things, I think, for the better. And a couple, Dr. Shores, who's on your show with you, he said the same thing. He says, I think it's a good idea.
Yeah.
To get some extra control over those types of medicines. And so I think overall it'll be better for patients, where the outcome will be, with lots more outcrying and, finances and stuff like that. But, the whole idea is for better safety for patients.
And for the effect on public health is going to be a net positive.
Ideally, yes.
We're hoping, yeah. Now, what's your thoughts on medical marijuana? People talk about the treatment of pain with medical marijuana.
Yeah,
you think that's coming to Florida? Or?
There was an article yesterday that I saw from AMA that was about that. Some groups are proposing that states that now have legalized medical marijuana have fewer drug overdose deaths. Because they're being treated with marijuana. The idea there being that, well, medical marijuana it won't fix you, but it'll make it so it won't kill you either.
Well, maybe it's just the abusers are switching over to something little easier.
I don't know. The thing is like, especially if you're smoking marijuana, you're generating a whole different set of issues, because now you're infecting your lungs and causing more issues with COPD, and those people lead to hypoxia and that kind of stuff. So it may not be causing a problem right now, but give it 10 or 15 years, and we're probably going to see a different set of outcomes from that.
Not to mention your cognitive abilities.
Yeah.
I mean, anything that compromises that. I told my kids when they were little, it's like, life is hard enough. Why would you want to drink? Why would you want to take drugs? I mean, why?
Yeah.
No, I enjoyed a cocktail like everybody else, but
right.
Not to the point where, it's a struggle out there.
Yep.
And I just don't understand it.
Yeah, there's a lot of folks that don't have the coping coping mechanisms for that. That's one of the things that I push a lot, is if you're using another substance or another, whether it's alcohol or smoking or prescription medications to try and cope with whatever you're doing, there's lots of ways to actually get you the kind of therapy and counseling you need to help you build coping skills so that you don't have to. It's like, you know what, I could probably just breathe deep for about 30 seconds here and probably not need that medication.
Or go for a run.
Something, yeah, exactly. That's another fantastic idea. Go for a walk, go for a run, go drink some water, go sit in a bathtub. I mean, there's a whole bunch of other therapies that people can use for coping skills, but they don't.
I'll have to let that be the final word. Thank you so much, Doc. So don't do drugs, go sit in a bathtub. We'll be right back.
I'm David Lovett, and this is your Mad Hatter Minute. Maintaining proper tire pressure helps increase fuel efficiency and driving performance. Correct tire pressure allows the driver to experience a smooth ride, and performance designed to match the needs of the vehicle. An underinflated tire becomes flattened, and more surface area makes contact to the road. If a vehicle's tire pressure is underinflated by as little as 6 pounds, it can mean damage to the tire. Lower tire pressure allows the tire to bend more as it rolls. This will build up heat back into the tire and reduce the tire's lifespan by as much as 25%. You will also experience a significant decrease in your steering with lower tire pressure. Look on the sidewall of your tire. It should have the maximum tire pressure that the tire can hold. You can inflate your tires up to that maximum amount of pressure, but don't go over. Overinflation of your tire can have just as serious consequences as underinflation. An overinflated tire creates too much air back inside the tire. Going over potholes and bumps in the road makes it an extremely rough ride. Additionally, overinflated tires will create premature tire wear. The correct amount of tire pressure can be easily checked with the tire gauge. To ensure your vehicle is running as smooth as it can, make sure the tire pressure is set to the maximum PSI. I am David Lovett, and that has been your Mad Hatter Minute.
Hey folks, this is Joshua Brown with Mad Hatter on 23rd Street. Is your check engine light on? If it is, text MADHAT28, that's MADHAT28, to 24247, and we'll check it for free.
Welcome back to the show. I'm here with Dr. Aaron Shores, and we're going to talk about back pain today, again, I suppose, and that spine and neuro pain specialist, as I read your pocket for the 100th time. You give a lot of injections there, don't you?
We do, yeah.
And you hear people who have had, back pain or accidents or whatever, oh, I got the shot,
Right.
And usually you think that's some sort of like steroid or cortisone or something like that. But there's a variety of shots that people get, right?
There are, yeah, and I find that to be a big confusion, especially for new patients into our practice that have had treatments for back pain or injections in their spine for one reason or another. And a lot of times I'll have patients come to me and say, well, I had the quote shots and they didn't work. And I always have to inquire, well, what does that mean? Because one of the things that I always explain to folks is not all shots are created equal. And not all injections are intended to be a lifelong treatment, which I think is sometimes confusing as patients because, when we go to the doctor, we get a shot, we expect that it's going to make us feel better. And in many aspects, that sometimes is true, but in treatment of the spine, in our practice, that's not always true because sometimes pictures, x-rays, and MRIs do not always tell the story, or at least not the full story.
I know shot is really going to be a magic bullet and cure you. Usually it's like therapeutic or diagnostic, or there's a variety of reasons you would get a needle in the back.
Correct.
Yeah.
That's exactly right. And sometimes in our practice, I tell our patients a lot that sometimes we do injections to find the problem, and sometimes we do injections to treat the problem. So I always try to make sure that I'm clear as much as I can be on this injection is just intended to find the problem. It's not intended to last 100 years. And then based on your result, then we'll make a decision on how we can treat it longer. Because sometimes patients, when you inquire about their prior history of injections, they'll say, well, I had the injection, it didn't work. And then what they really mean is that they had good relief. It lasted for an hour or a day or two, but it didn't last that long. So in the patient's mind, it didn't fix their problem. But to me, that oftentimes means something different, which, if they have good short-term relief, that may say, well, hey, maybe we're in the right spot. but we just didn't come up with the right option, or the injection you had wasn't intended to last a long time.
Is it always cortisone? Is it always steroids? Or
Yeah, no, actually
Yeah.
it's not. And there are many injections that I do in the office that do not have any steroid, but certainly there are some that do. But that depends on the condition that you have and your symptoms. So just because your friend or your neighbor may have had a, quote, steroid shot in the back doesn't necessarily mean, number one, that that's what you need. And whether it worked for them or not is difficult to predict, because I often get asked, well, how long is this injection going to last? And I just am truthful with folks and say, I don't know. Everybody responds so differently.
Till it starts to hurt again.
Right, right.
Yeah.
Till your back pain comes back.
Yeah.
So it's just variable, and that, I think, is some of the frustrating aspects of having back pain. Is just that you might have an injection in your back for therapeutic purposes that may last you 2 or 3 years or forever. And then I may have one and it lasts a week and wears off. And what that's the trial and error aspect of treating the spine. But you want to make sure that you maximize those conservative options, so that sometimes being more aggressive when the approach to the spine is the correct thing to do, and sometimes it's not the correct thing to do. And it takes a skilled evaluation and sometimes a team of doctors to be able to make that decision.
And not all steroid shots, I would imagine, are the same. I mean, there's different types of steroids, I would imagine.
That is true.
And there's different strengths, I suppose.
Well, there are definitely different types of steroids, and some have different side effect profiles than others. Some work a little bit quicker, last a little bit longer, and that's something that needs to be considered as well when looking at an individual patient and the risk of the particular injection. But a lot of folks also worry about the side effects of steroids, as well, as they should.
Yeah. And yet, what exactly is a steroid? Because you hear the horror stories of like bodybuilders who take steroids and go crazy and crush cars and stuff. What
Right.
What is a steroid?
There are several different kinds of steroids. A steroid is, in my particular practice, is used as an anti-inflammatory. The steroids that bodybuilders take, or you hear about on other venues, are a type of hormone replacement that causes certain types of body growth. In my practice, a steroid can also be an anti-inflammatory to help decrease inflammation around a particular structure, whether it be not only in the spine but anywhere else in the body, because a lot of folks have had injections in joints and other parts of their body as well, and it can help with inflammation, and in some instances short term boost the immune system and help recovery. So
I guess the short answer is, if you get the shot, if someone tells you, hey, get the shot from the doc, know what you're getting into and have educate yourself about what you're going to get.
Correct.
And what you're going to need and how it's going to work, and there's no silver bullet to any of this, is there?
Correct. And understanding too when something's therapeutic and when something's intended to just find the problem, I think, will help with some frustration and understanding as well, which can be discussed with your physician.
Dr. Aaron Shores, we're going to have to let that be the last word, but thanks so much for getting us smart on the shot.
Thank you.
And we'll be right back. Welcome back to the show. It's Monday, and it's time for your Thrive Thought from Thomas Winterman. Thomas, thanks for coming back on the show.
Sure.
And again, your book, The Thrive Life, is available on Amazon.com.
Yes.
And where else?
That's it.
That's it. Amazon.com.
Well, that's the place to go.
Yeah, that's the place to go for the Thrive Life.
Right.
To get some really good life tips. And you give us a tip a week now
to
kind of get us through the week. Now,
That's right.
what's your tip for this week?
For this week, it would be to take a time in.
Okay. I've heard of a time out.
Right.
Time in meaning what?
You would think from the name it's the opposite, but it's really very similar. Time in is when you take time to sort of go inward, look inside yourself, disconnect, turn off the TV, turn off the radio, get away from the family, maybe go to a room where you can be by yourself, where it can be completely quiet, and you can take some time to focus inwardly on yourself.
So are you sitting, are you laying down, are you napping, are you doing yoga, or just being comfortable?
Ideally, you're still awake.
Okay.
But being comfortable is key. Sitting, standing, laying, however you want to do it. The point is to really just focus on yourself for a couple minutes, and don't let your thoughts wander off to work, wander off to family, what you're going to do, what you're going to eat for breakfast the next morning. Just really be inside yourself for even 1 minute is helpful.
Mm-hmm. And what does that do for you?
Well, one thing that it does is it really helps you be in tune with who you are. It really it helps you focus. It's what we call a mindfulness technique, which is important because mindlessness is when you do things without thinking about it. So what we want to do is become more mindful. We want to become more aware, and this is actually an exercise to help build up that skill.
Now, it sounds a lot like meditation to me. And is it really like a form of meditation? Or?
It can be for some people. Some people choose to have that time as meditation. Some people choose to have that time and call it prayer. Some people choose to have it and call it whatever they want to, whatever it is. You know, as long as you're by yourself, it's quiet, and you're to yourself, it can be whatever you want to call it.
And do you practice that regularly? And should you do it once a week or once a day? Or
you should do it as often as you can. I try. I get maybe a couple times a week. Ideally, you want to do it once per day. Even if you can just get 30 seconds, 1 minute at a time, it's something that, like I said, is a skill, and it builds over time. You're not going to be able to do half an hour right off the bat. You're going to get bored. Your thoughts are going to wander. But eventually, over time, you can build up to a place where you can do more.
So everybody's got 1 minute a day.
I would hope so.
Yeah. You can squeeze in 1 minute somewhere along the way.
Yeah.
You don't have to sit in a lotus position to do it either.
No.
Okay, so that Thrive Thought again is what now?
Take a time in.
Well, thanks for that Thrive Thought, Thomas. So let's take a time in, and we'll see you next time.